Hello, welcome to one of the first feedback from the board that I'm going to be doing on a regular basis. I think it's really important that we communicate some of the highlights that we talk about every month. This month there's three particular things I want to provide highlights on. The patient and staff story is an item we do at the start of every board, and this month we focused on mental health services for older people, and we had some really brilliant examples of the great work staff doing in those services, in particular highlighting some of the quality improvements that are going on. It was really helpful for the board to understand some of the challenges, for example the complexity of the patients that these teams are seeing now, some of the requirements to enable access to good quality physical health care, and also access to crisis teams. One of the challenges that staff were keen to highlight was, that, again, something we're aware of and we need to take some rapid action on, is the mounting bureaucracy that we put into our teams and services, and it's something I'm really keen to address and see how we can help. The next part of the board was quite a detailed conversation around something called the Integrated Performance Report, which sounds a bit dry, but is a vital piece of work that lots of people are involved in, and that's translating all the data that we receive from multiple points and putting it into a useful, informative report that can guide us on what's going well, where the challenges are, and where we need to focus some of our help and support. It's an iterative piece, so it's continued to be developed. We concluded it wasn't quite there yet, but I'm really optimistic over the next few months we can have a report that works from a ward and team level right the way up to the board to help keep people sighted on what the key issues are. The final piece from this month, I just wanted to talk a little bit about where things are from a national perspective. There's lots of quite significant change afoot in all things national health and social care, and this has been summarised in some detail in something called the long-term plan, which is a 10-year forward look into how health and social care needs to adapt and change to the changing environment that we work in. Financial austerity, unfortunately, is going to remain. The demands of an ageing population will continue to increase, and expectations on health providers will continue to rise. So it's a big challenge for us, but I'm really optimistic that we can do this together well. The long-term plan itself is a detailed read, but there are summaries available. And some of the key things are around moving away from a competitive internal market, and divisions between commissioners and providers will be reduced, which is really heartening news because we're all in this endeavour for the same reason, and working collectively I think will add value and be of benefit to our patients, carers and families. Thank you.